custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we have a caller on the line. Good morning, you're on the radio.
Good morning, Dr. Lederman. I was wondering if you've ever treated someone who has had esophageal cancer that's been already treated with surgery and chemo, but seems to be coming back.
We do that almost every day, and the reason is that surgery and chemo don't work very well for esophageal cancer. So we treat it in the esophagus, we treat it in the liver, we actually treat it wherever it might be. And when we look at our data, our success rate in stopping or shrinking the cancer, esophageal cancer, is about 90%. So the beauty is it's very well tolerated, it's very successful where we aim the beam, and often gives good relief of symptoms.
So your practice deals strictly with this beam, and a person does not need to have chemo or anything else?
Well, you've told me that the chemo, he's had chemo and doesn't work.
Right. Well, now they're considering giving even stronger chemo because it seems to be, they're not sure if it's in the sinus passage and also around some of the scar tissue from the initial surgery.
Well, look, first of all, as I said earlier in the program, if something's not working, doing it more and more and more is not going to make it better. And in fact, the chemo that was already given probably has made the cancer more aggressive and less likely to respond. So when doctors give chemo the second time or the third time, it's less likely to work than it did the first time. So they do that because they often don't have any other answers, or they don't want to relinquish control of the patient. But in fact, it doesn't work very well. Often it's not very well tolerated. Many people with esophageal cancer have gone through a lot, and they haven't got their strength back or their abilities back, and they've been really weakened by the cancer, they've been weakened by the surgery, they've been weakened by the chemo. And so more chemo, and you're telling me stronger chemo, well, that probably will weaken the patient more and is not very likely to benefit. But there's different options, and I would tell you it's best really to come in. And, if there's cancer in the sinus, we can easily hit cancers in the sinus. And you can treat one spot with radiosurgery and one spot with chemo and see which works best. Or most people that I see, some people do that because they're afraid to give up chemotherapy. It's kind of like a comfort blanket. And so I have no problem doing that, to use radiosurgery and chemo together if that's something you wish. But also many of our patients, like the woman I told you about with the fallopian tube cancer, she had 5 years of cancer treatment of chemo at a big cancer hospital. Nothing worked, and they just kept on giving her more and more of the same. We gave her 5 treatments, and she's in remission. So, there's options. And
if the person feels that they still want, like you said, the comfort of the chemo, that would be something that is done in your place? Or
yeah, sure. We work, or you can keep your own doctor. We don't, we believe that, and I believe that the patient is like the President of the United States. The President of the United States gets to choose what they want, and we, the doctor, are just the advisor. So we talk about all the options. Some people in his case may want to have chemo only, or they may not even know there's options. Some people come to us and want radiosurgery only because the patients that come through radiosurgery usually have good relief, usually it works, and usually it's a lot easier than the treatment they've had. And some people want both. That's up to the patient and the family.
Well, thank you. That's been very thorough.
All right, God bless you. And if you want, call during the week and we will send you the booklet and DVD about our work.
Okay, I appreciate that. Thanks.
Thank you. Bye-bye, you too.
Bye.
So we're going to talk something about the waiting game. The healthcare waiting game was in the New York Times this week, saying that Americans look down on, this is an article by Elizabeth Rosenthal in the New York Times this week, saying Americans look down on national health systems like Canada and Britain because of their long waiting lists. But the VA hospitals have been pilloried for long patient wait times, and there's evidence that there's long waiting times to get a doctor's appointment in many parts of American medicine for general doctors and also specialists. There's a company called Merrill Hawkins, which is a physician staffing company that's found long waiting lines when it polled 5 different kinds of doctors' offices for appointments, heart checkups, knee pain, gynecologic. It varied. The study found that 26% of Americans waited 6 days or more for appointments. There are some appointments which took a long period of time. In Canada, follow-up radiation treatment takes more than a month to see a doctor. And the article goes on. You can read about it. But the point is that a lot of people are waiting a lot of time, and we've responded to that by offering something called the Urgent Cancer Consultants, where you can see our physicians, including myself, within 1 business day, because we believe that if you have a cancer, there's a lot of anxiety, there's a lot of stress for the patient and for the family, knowing what to do. So we promise to see patients within 1 business day. You just call us at 212-CHOICES, which is our business office, which is in numbers 212-246-4237. Again, that's 212-CHOICES, which is 212-246-4237. And we promise not to make you wait unless you want to. If you want to wait, that's your business, but in general, we don't want people to wait unnecessarily. Hey, the good news department. Here's a man who came in from Connecticut this week. I saw him in 1999. He came to me with a cancer of the finger, the big finger of the left hand. And at that time in Connecticut, he went to a big cancer treatment center, a big university hospital, and they wanted to cut off his finger. So he came to me, got redirected, got radiation, and he came to me to show me this week, 14 years later, cancer-free. So does radiation work for skin cancers when others were going to remove his finger? Yes. High durability? Yes. Is he happy? Very. Now he's got another medical problem, and he came back from Connecticut for that medical problem, which most probably is not cancer. We saw him. He is happy. I am happy. It's nice that patients come back, show the results. He's done great, and I wish him many, 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 many years of good health. And here's another man who came actually from New England as well, 74-year-old man with skin cancer. He had Mohs surgery. He had grafting because they left such a big hole in his head. Then he had 6 weeks of radiation. And right in the middle, the cancer came back, despite Mohs, which is a big salami slicing operation, despite a skin graft, despite standard radiation. So he came to us for evaluation and treatment of his skin lesion, and that's what we're doing. We have options, even though he had prior radiation, and that's a common question. Doc, if I had prior radiation, can I still qualify for radiosurgery? And the answer is most likely yes. But obviously it's best to come in and sit down and spend some time together. This is Dr. Lederman from Radiosurgery New York. We're a cancer treatment center in the heart of New York. We're close to most buses, subways, trains. There's parking, Penn Station, Grand Central, Port Authority. It's easy to get to us. We take most insurances, Medicare or Medicaid. We believe you do have choices. That's why our phone number is 212-CHOICES. You don't have to accept what someone tells you. You get a second opinion, and we think a second opinion often is very critical to your well-being. Like this man with a finger who would have lost his finger had it not been for a second opinion 14 years ago. So if you have a cancer and you want information, call for our booklet DVD. If you want best advice is to come in, spend some time together. So we wish you well. Thank you for listening. This is Dr. Lederman. Thank you, and God bless you. Talk to you soon. We'll be back at 9 o'clock tonight. Bye now.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 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 212-CHOICES.